What physical activities, like exercise, should I be able to do years after having knee surgery? I'm Dr. David Geier, orthopedic surgeon and sports medicine specialist, and I provide education and commentary on all sorts of sports and exercise, injuries and injury treatments, and injury prevention for athletes and active people, probably much like yourself, so that you can stay healthy and perform your best. You know, one of the most common knee surgeries, probably the most common knee surgery that orthopedic surgeons and sports medicine specialists especially do, are surgeries for a tear of the meniscus. That's the C-shaped shock absorber, really, that between the bones in the knee, between your femur and your tibia, that prevents not against just stress with pounding, but also injuries or movements like twisting movements. Unfortunately, it's very common to tear them, and they very often don't heal on their own. So people have surgery, and like I said, that's the most common knee surgery, maybe one of the most common orthopedic surgeries overall. You know, so what can people reasonably expect to do? Because again, these are typically active people that suffer this injury. People that like to run or lift weights or play golf or play tennis, or they just like to, you know, go to work, but it may be a physically demanding job. What's a reasonable expectation for their physical activity? Not just in the months after surgery, but 5 and 10 years down the road. In today's Ask Dr. Geier video, I answer that question specifically about a patient about to have a meniscus surgery. Guy asks, I was literally just about to join the Air Force and I tore my meniscus 2 weeks ago. I'm getting surgery in a couple of weeks. I've had ACL surgery about 10 years ago, but I was fine up until this injury. After surgery, I'm just hoping that I'll be able to comfortably run 3 or 4 times a week for the next 4 years. Is this a realistic expectation for many patients after this surgery? That's a terrific question. What Guy's getting at generally, and this is true about 85% of the time with meniscus tears, the surgery involves trimming out the part of the meniscus that's torn. Yes, there are some meniscus tears that can be sewn back together with stitches, and that is typically young, active people, high school and college age athletes, but you can see that in young adults as well. But the vast majority of the time, you're trimming out the part of the meniscus that's torn. So you lose a little bit of that shock absorber, you know, that the meniscus is. Now, you're not taking a huge part of it out, hopefully. You may just be taking 10, 15, 20% of it out. But the concern is, and I think this is a little bit about what Guy's getting at, is that going to cause a problem with sports and exercise down the road? We know that after trimming part of the meniscus out, again, that surgery is called a partial meniscectomy, that 10, especially 20 years down the road, there is a little bit of a higher rate of arthritis in that knee compared to the opposite knee where you didn't have part of the meniscus trimmed out. Having said that though, the part of the meniscus that's torn isn't really serving as a good shock absorber anyway, plus you hurt and can't play sports and exercise, so people end up having surgery, but you can't really prevent that. This is a little different with a meniscus repair, where you do sew it back together and you save that meniscus, you save that shock absorber. I've talked about that in other videos, so you may check that out on my YouTube channel. But having said that, you lose some of the shock absorber with a partial meniscectomy. Now, should you then give up running, give up lifting weights, things like that, just because there might be a higher risk of arthritis? I would say no. I would say the goal is to get you back to exercise, to get you back to sports. Could you develop arthritis 20, 30 years down the road? Absolutely, there's no question. And in theory, worst case scenario, yes, you may need a knee replacement way down the road. But having said that, the health benefits of exercise, the psychological and emotional and the social benefits of exercise, I would argue, far outweigh the risk of developing arthritis down the road. You know, saving or not having the risk of arthritis doesn't do you that much good if you end up having a heart attack because you've been sedentary all this time. So I would say if you have that surgery, get back to what you want to do. Maybe you modify it a little bit though. So maybe instead of running 7 days a week, maybe you run 4 days a week and you do non-impact exercise the other 3, like lifting weights or cycling or riding a stationary bike or swimming, things like that. There's lots of variety you can do where you can cut down a little bit on the repetitive stress. But I would argue our goal as orthopedic surgeons and as sports medicine specialists is to get you back to what it is that you love to do. So get it checked out, talk to a doctor, find out what he or she thinks you're going to be able to do. Have this discussion. This is what I like to do. Will I be able to get back to that before surgery? So you kind of have an expectation, but the goal again is to get you back as quickly and safely as possible. Now, have you had meniscus surgery and wanted to get back to sports and exercise? Or did you have it a long time ago? Maybe you developed arthritis down the road. I would love to hear your experience, your stories. So below this video, share your comments, share your experiences. I would love to read it, and I know people all over the world would love to hear your experience because I bet they're dealing with the same thing. If you know somebody that's had meniscus surgery, please share this video with him or with her so that they can have maybe a reasonable expectation of what we hope they can do after that surgery. If you like videos like this and you want more information on sports and exercise injuries, injury treatments, and injury prevention, subscribe to my YouTube channel. Click the subscribe button in the upper right corner of the page and you'll get videos on ways to stay healthy and perform your best several times a week delivered directly to you. Thank you so much for watching. Again, I'd love to hear your experience with meniscus surgery. Don't forget to subscribe, and I look forward to seeing you right here next time.